Hello everyone, Dr. Congratulations here and welcome back to the channel. Let's talk about hemorrhoids today, guys, shall we? Yeah, let's talk about hemorrhoids. Before we go forward, you guys know the drill, right? Like the video, subscribe to the channel, and hit the notification bell. I need you to be informed automatically when I post a video. That way things run a little bit smoother, okay? All right, back to the issue, hemorrhoids. What are hemorrhoids, guys? What really are hemorrhoids? You might have heard of it, you may not have heard of it, but one thing for sure is I know a lot of people are dealing with these things out there because we see patients, and most times by the time they come to the hospital, they have dealt with it for a while and now they cannot take it any longer. Many people find it a bit of an embarrassing issue, so they will not open up about it. But hey, guys, we're here to help. That's what the doctors are for. Now, hemorrhoids, basically, in the most simple terms, hemorrhoids are swollen blood vessels. Okay, vessels that are swollen in the anal or in the rectum or in the anal area. Okay, so hemorrhoids are basically veins that you get that swell up, engorged with blood, and they can be really painful and they can be very discomforting. Okay, so how does one know they have hemorrhoids? Many times it will be a swelling in the anus that is quite painful. Sometimes you have a lot of pressure symptoms. You may have itching along with it, and you may have, in the worst case scenario, sometimes bleeding as well. Okay, especially when you pass stool, you will see bleeding on the tissue paper, or but in the worst case scenario, you may experience bleeding. Now, hemorrhoids are of two types. You may have both. You may have internal hemorrhoids, but there are also external hemorrhoids. The external hemorrhoids are the ones where you see the swelling come up, you can feel it, but many times the swelling goes back. But the internal hemorrhoids, you will probably not feel or be able to touch the swelling externally, but you will experience symptoms which may be pressure symptoms, which may still be pain or itching or bleeding, whatsoever the cause. But hemorrhoids present in such ways. Now, who can have hemorrhoids? Pretty much everyone. Okay, anyone can get hemorrhoids. And we see a whole range of patients from much younger ones to much older ones. But what mostly will cause hemorrhoids? One is obesity. Okay. Now, the overriding principle is that anything that increases abdominal pressure is able to cause hemorrhoids. Okay. Now, obesity is one of those. Pregnancy is another. Long-standing constipation or diarrhea can actually lead to hemorrhoids too. Anal sex, okay, is one of those things that can lead to hemorrhoids. Sitting for very long periods of time is another possible cause. Lifting very heavy weights, or when you go to the bathroom, you sit in there for a long time, uh, or you strain a lot as you're trying to pass stool. All these can cause hemorrhoids. Okay. The good news is, guys, that when hemorrhoids happen, they really are something that many times can clear off by themselves. Okay, a few precautionary measures here and there, and they are cleared. The bad news is once you have hemorrhoids, it's more likely than not they may happen again. So they may happen a few days after, they may happen a few months after, or years after. But if you've had them before, more likely than not, they will happen again. So you just need to look out and take some precautionary measures. What precautionary measures could one take? One, watch the weight. Okay, avoid things like obesity. Two, have a high fiber diet. This is actually something that helps to soften your stools, helps you to pass stool much easier. Exercise, okay, with the numerous benefits that exercise could possibly bring, this could be one of them. What else could you do? Try not to sit in the bathroom for a long time. Try not to strain too much as you pass stool. Maybe you could avoid lifting extremely heavy weights. Maybe you could avoid things like anal sex, okay? But in the long run, even using things like stool softeners, okay, like laxatives when you experience things like constipation, go a long way to helping you to avoid things like hemorrhoids, okay? So yes, those are some of the things that will help. And always do drink a lot of water. Numerous benefits. Drink a lot of water. Now, yes, when hemorrhoids do happen, there are things that you could do, like the ones that I've just mentioned, that can help you to manage it without even needing to go to the hospital. But there are certain times when you really do need to go to the hospital. Okay? One. Now, one thing that may indicate that you actually do need to go to the hospital is when you have persistent pain. You're using your painkillers, you're trying to avoid straining, you're trying to do, the basics that may, in normal circumstances, help. But the pain persists, it's not clearing in spite of anything you do. Get a consultation, go to the hospital. Maybe there could be a complication like a tear in the anal area. There could be something else. Just let your doctor, to review and help you identify anything else. Now, could there be bleeding? That is another indicator that you need to get to the hospital and have a consultation, because it may be an indicator of something more than just hemorrhoids. Okay, there's a lot of things that may cause bleeding in that area. In the worst case scenario, it could even be a cancer. So if you're experiencing bleeding, get your doctor to check that out for you. All right. Now, when you get to the hospital, of course, there are possibilities of what the doctor could help you prescribe to deal with your symptoms. It could be a cream that is a numbing cream. Okay, it could be suppositories that you insert. It could be pain medications that you actually get to swallow. But there are a lot of options that the doctors will give you. Now, in the severe cases, surgery may be indicated. So your doctor may tell you, you know what, this, we need to address it surgically. And so that happens as well. But more importantly, look out for those danger signs that may need a doctor's consultation. All right. So yes, guys. Now I hope that helps. It's something you shouldn't be shy about. Many people are dealing with this, but the few tips that I've given, I'm sure can go a long way to enlighten and to help someone out there. So let's pick it up from there next time, guys.